I'm Kelly Warner. Patients with cancerous tumors in the liver now have a new option for treatment with radiation therapy. The FDA recently approved a small transponder beacon that can be used to track the tumors, increasing the accuracy of the treatment while reducing the risk of certain side effects. You might call it GPS for the liver. Diagnosed with ovarian cancer in 2013, Marcy Sexton has seen the inside of Willamette Valley Cancer Institute more times than she can count.
They said if it doesn't come back, you have a chance of remission. If it comes back, then it then turns into a disease, and you just fight it. You just keep throwing things at it to keep it down.
Despite surgery and aggressive chemotherapy, Marcy's cancer returned in 2015 and again this year in her liver. But this time, one of the tumors was in a tricky spot.
And it's just really hard to catch because it's at the very top of the liver, which is right up against the diaphragm and the bottom of the lung, so it moves a lot with any sort of motion.
Every time Marcy breathed, her tumor moved, making it difficult to treat with radiation therapy.
We didn't know how that last tumor was going to be taken care of. When they told us that there was an option, it was amazing.
Last year, the FDA approved the use of a new radiofrequency transponder. The size of a grain of rice, the transponders are implanted inside the patient. And while Marcy consistently holds her breath, something she had to practice during several planning sessions, a system called Calypso uses the transponder signals to track the tumor's slightest movement in real time. This allows the high-dose beam of radiation to be turned on only when the tumor is in the right position and turned off in the event of a cough, sneeze, or other internal change that moves the tumor out of the X-ray beam. This control helps protect the healthy tissue surrounding the tumor.
By doing this, we could really shrink down the area of radiation just to target the tumor with a really small margin, not only confirming that we're targeting what we want to target, but missing what we want to miss.
Marcy praises WVCI's radiation therapy team for the planning, training, and quality assurance that was required for this procedure, allowing her to be one of the first patients in Oregon to receive treatment in this manner for a tumor in the liver.
And for everybody who will have an opportunity to have this happen for them, it gives them just another chance and more hope for them also. I'm just very thankful.
Since she finished her treatment, Marcy's tumor markers have dropped, which is a good sign, and her oncology team will continue to monitor her prognosis. While these beacon transponders are currently FDA approved for use in radiation therapy for liver cancer, they're also being studied for use in breast cancer. I'm Kelly Warner.